All right, so today we're taking a deep dive into something that a lot of folks probably, well, have heard of, but maybe, don't fully understand, spondylosis.
Yeah, it's one of those conditions that, sounds a little intimidating, right?
It does sound a bit, medical and serious.
But really, at its core, it's about those changes that happen in our spines as we age.
Right, those sort of wear and tear changes, I guess.
Exactly, wear and tear. And you know what? It's actually incredibly common.
I guess that makes sense because our spines, they kind of take a beating over the years, right?
They really do. I mean, think about it. All the bending, twisting, lifting we do throughout our lives.
Yeah, not to mention just, sitting at our desks all day.
Exactly. All of that adds up.
So let's break it down a bit. What's actually happening in the spine when we talk about spondylosis?
Sure. So the simplest way to think about it is, imagine the discs in your spine. They're like these little cushions between the bones or vertebrae.
Right, I've seen those diagrams. They kind of look like jelly donuts or something.
Yeah, kind of. And over time, those discs can start to lose some of their fluid, so they become less, squishy, less able to absorb shock.
Like a dried out jelly donut, I guess.
Exactly. And as those discs lose their cushioning, the bones start to rub against each other more.
Ouch, that sounds painful.
It can be. And, to make matters worse, sometimes the body tries to overcompensate by growing extra bone, which is called bone spurs.
Bone spurs.
Yeah, and those spurs can actually press on nerves.
Oh, I see. So we've got these discs drying out, bones rubbing together, and then maybe even bone spurs pinching nerves. No wonder spondylosis can cause problems.
Right. And, the thing is, it can affect any part of the spine.
So we're talking neck, upper back, lower back, all of the above.
Exactly. And depending on where the spondylosis is happening, the symptoms can be a bit different.
So let's talk about those symptoms. What should people be looking out for?
Well, the most common symptom is pain, of course.
Makes sense. I mean, if you've got bones rubbing together and nerves getting pinched, it's bound to hurt.
Right. And the pain can be, kind of a dull ache, or it can be sharp and shooting.
And I imagine where the pain is depends on where in the spine the spondylosis is, right?
Exactly. So if it's in your neck, which is called cervical spondylosis, you might feel pain in your neck, shoulders, or even headaches.
Well, that's interesting. So neck pain isn't always just from, like, sleeping wrong or something.
Nope, it could be a sign of spondylosis. And if it's in your lower back, which is called lumbar spondylosis, you might feel pain in your lower back, buttocks, or legs.
And this pain, is it, like, constant, or does it come and go?
It can vary. For some people, it's pretty much always there, while for others, it might flare up after certain activities.
Okay, so pain is a big one. What else?
Well, another common symptom is stiffness.
Stiffness, like having trouble moving your neck or back.
Exactly. It might be hard to turn your head, bend over, or even just stand up straight.
And that stiffness, is it like worse in the morning, or does it kind of come on throughout the day?
It can be worse in the morning, yeah, because the joints have been inactive for a while.
Right, like that feeling of needing to, like, loosen up or stretch.
Yeah, exactly. Now, in some cases, people with spondylosis can also experience numbness or tingling.
Uh-oh, that sounds a bit more serious.
It can be because it often means that a nerve is being compressed.
And I guess depending on which nerve is being compressed, you could feel that numbness or tingling in different parts of your body, right?
Right. So if it's in your neck, you might feel it in your arms or hands.
And if it's in your lower back?
Then you might feel it in your legs or feet.
Okay, so pain, stiffness, numbness, tingling, anything else we should be aware of?
Well, in some cases, spondylosis can also cause muscle weakness.
Muscle weakness, wow. So it's not just about discomfort, it can actually affect how well you can move.
Yeah, that's right. When nerves are compressed, they can't send signals to the muscles as effectively, which can lead to weakness.
So it sounds like spondylosis can range from, kind of annoying to pretty debilitating.
It definitely can. But the good news is that there are things people can do to manage it.
Okay, let's talk about that. What are some of the treatment options for spondylosis?
Well, the first line of treatment is usually conservative measures, things like lifestyle modifications and physical therapy.
So not jumping straight to surgery or anything?
No. In many cases, those conservative approaches can be very effective.
So what kind of lifestyle modifications are we talking about?
Well, one of the most important things is maintaining good posture.
Posture, like sitting up straight and all that.
Exactly. Because poor posture can put extra stress on your spine, which can worsen spondylosis symptoms.
So I guess it's not just your mom nagging you when she tells you to sit up straight.
Nope, it's actually good advice. And it's not just about sitting either. You want to be mindful of your posture when you're standing, walking, and lifting things too.
So like engaging your core, lifting with your legs, not your back, that kind of thing.
Exactly. And, another important lifestyle modification is losing weight if you're overweight or obese.
Right, because that extra weight puts more strain on the spine.
Exactly. Now, in addition to lifestyle changes, physical therapy can be really helpful for spondylosis.
So what does physical therapy involve in this case?
Well, a physical therapist can teach you exercises to strengthen the muscles that support your spine.
So like core strengthening exercises.
Exactly. A strong core can help take some of the pressure off your spine.
And I imagine they might also show you some stretches to improve flexibility.
Yeah, definitely. Because as we talked about, stiffness is a common symptom of spondylosis, so stretching can help with that.
Okay, so posture, weight management, physical therapy. What about medication? Can that play a role?
It can. There are various medications that can help manage pain and inflammation.
So like over-the-counter pain relievers or maybe something stronger if needed.
Right. There are non-steroidal anti-inflammatory drugs, or NSAIDs, which can help reduce both pain and inflammation.
And I guess in some cases, a doctor might prescribe muscle relaxants if muscle spasms are a problem.
Yeah, that's possible. But it's important to note that medication is usually not a long-term solution.
So it's more about managing symptoms while you're working on those lifestyle changes and doing physical therapy.
Exactly. Now, in addition to medication, there are also some other therapies that can be helpful.
Like what?
Well, something as simple as hot and cold therapy can make a difference.
So like heating pads and ice packs.
Yeah. Heat can help relax muscles and relieve stiffness, while cold can reduce inflammation and numb pain.
Makes sense. It's like those basic things you do for a sore muscle.
Right. Now, in some cases, a doctor might also recommend steroid injections.
Steroid injections.
Yeah, these are injections of corticosteroids, which are powerful anti-inflammatory medications that are injected directly into the affected area of the spine.
And that helps reduce inflammation and pain, I guess.
Exactly. But again, it's not a permanent fix.
Yeah. So we've got lifestyle modifications, physical therapy, medication, hot and cold therapy, steroid injections. Is there anything else, or are we getting into like surgery territory now?
Well, surgery is typically only considered as a last resort when other treatments haven't been successful.
So, like, if there's severe nerve compression or damage that's not responding to anything else.
Yeah. In those cases, surgery might be an option, but it's a big decision, and it's important to weigh the risks and benefits carefully with your doctor.
Okay, so it's not something to be taken lightly.
Yeah.
We've covered a lot of ground here. Any final thoughts you want to leave our listeners with about spondylosis?
I think the most important thing to remember is that while spondylosis is common, especially as we age, it doesn't have to control your life.
Right. It's not like a death sentence or anything.
No, not at all. By understanding the causes, symptoms, and treatment options, you can take an active role in managing your spinal health.
So it's about, like, being proactive, not reactive.
Exactly. Don't wait until you're in excruciating pain to start taking care of your spine. Start incorporating those healthy habits now, like maintaining good posture and staying active.
And if you do start experiencing symptoms, don't just ignore them, right?
No, definitely not. Talk to your doctor, get a diagnosis, and come up with a treatment plan that's right for you.
Great advice. Well, thanks for joining us on this deep dive into spondylosis. We hope you learned something new and feel empowered to take care of your spine.
Absolutely. Thanks for having me.
And to our listeners, thanks for tuning in. We'll catch you next time on The Deep Dive.
See you then.